Tēnā koutou katoa. My name is Janine Ellison, and this presentation on why senior nurses leave the acute setting is based on my integrative review I completed as part of my Masters. My current role is a nurse educator at Waikato Hospital. I've worked there my entire nursing career since 2004, mostly in acute areas. I was a senior bedside nurse for over a decade prior to becoming an educator, so this topic is something I am very passionate about. I wanted to start this presentation with a simple question. Why do we care? Why do we care about retaining these senior experienced bedside nurses? Well, globally we don't care actually. I struggled to find research on why this group of nurses leave hospitals, and there is very little research on this topic. There is a lot of research on why NEPs leave, on the retention of NEPs. There's even a fair amount of New Zealand research on the topic of NEPs, which is great. We need to retain our new nurses to ensure the longevity of the workforce. But who will precept and support these new nurses? Who will teach the new nurses skills and knowledge to grow their practice? Who will role model quality patient care if we fail to retain our experienced clinical nurses? Who will care for the sickest patients, coordinate shifts, work in resus and triage? Who will lead emergencies, de-escalate agitated patients, and recognise early deterioration of patients if we lose these nurses? I will leave you with this question to contemplate while I discuss my research findings. Do we really appreciate and value the role of the senior bedside nurse in the acute wards and emergency departments? I'll start with the background. Nurses make up the highest group of healthcare workers in New Zealand. According to the New Zealand Nursing Council in 2013, there will be a nursing shortage in this country of up to 15,000 nurses by 2035. So this data is 8 years old, so I imagine with the pandemic and the border closures that we could be in a worse situation than the predicted 15,000. New Zealand nurses have one of the highest turnover rates globally, approximately 3 times higher than Australia. In 2019, the DHBs were asked to develop a strategy for the retention of the existing nursing and midwifery workforce and the re-employment of those who had left the workforce. And they were asked to report back to the Ministry of Health by the end of May 2019. So this indicates to me that nurse retention in the hospitals is a priority in New Zealand and was a priority for the Ministry of Health. But it doesn't seem nurse retention as a priority to the DHBs if we look at the recent MECA negotiations. The World Health Organization also has made nurse retention a priority. There are financial costs to the loss of these nurses also. So a New Zealand study identified that each senior nurse lost to the acute care in New Zealand is equal to half the salary of a nurse, so about $30,000 to $40,000. This is due to the costs involved in replacing the nurses, such as advertising, training, temporary staffing, and orientation periods. There's also a lot of training involved in replacing a senior nurse. It can take years for nurses to gain all the skills a senior nurse possesses. So that's study days, all those kind of things add up to the cost as well. Many studies show that the adverse patient events and medication errors increase in areas of high nurse turnover. So this turnover leads to increasing patient length of hospital stay, contributes to increased patient mortality or delayed recovery, decreased patient satisfaction, and increased medication errors. There's also the loss of institutional wisdom. So we all know a nurse, a senior ward nurse or ED nurse that just knows so much simply because of their experience. If the acute areas are short-staffed due to nurse attrition and the remaining nurses must care for extra patients, there are dire consequences. Many studies show that for every extra patient a nurse must care for during their shift, above the optimal nurse-patient ratio, the risk of patient mortality and morbidity increases. There's also secondary turnover. So that occurs when senior nurses start leaving an area and more pressure is put on the ones who remain. So they leave also. So I'll go on to So what were my findings? The literature covered people who had left and those intending to leave. Identified 3 themes from the literature. The first theme was support factors. So the direct manager has a large influence on retention. So the charge nurse, the unit manager. So aspects such as poor manager organisational skills, poor recognition of nurses, There was a perceived lack of understanding from management of the, as one nurse put it, hard slog that is nursing. Manager not sticking up for them when they have complaints, so not being on their side in complaints. Lack of clinical presence in the ward and approachability. Poor collegial support. Some of the studies of nurses said that they felt their colleagues wanted to support them but had no time to support them, and fault finding by other colleagues. The second factor was workload factors. So high patient acuity, high patient to nurse ratios, high workload, being chronically short-staffed, which we're seeing at the moment in New Zealand in the DHBs. Health as a business and not patient-centred, people said, which made them think about leaving. Nurses in the study said one of the greatest rewards of nursing was patient contact, but with the high nurse-patient ratio and patient acuity, there was less time for this patient contact. This led to dissatisfaction, which led to intent to leave. This was particularly the case with senior nurses who felt responsible for their own patients as well as assisting the junior staff with their patients. The third factor was professional factors. So nurses felt there was no career development or promotion opportunities, not enough education, particularly education related to the practical skills needed for their jobs and roles. Also in the literature discussed, senior nurses often miss out on education opportunities as there are fewer of them, and they are often indispensable as they need to provide experience on the wards. Their education days were more likely to get cut to fill roster deficits than junior staff. Due to this, the nurses felt they fell behind in acquiring new and updated skills, and this can affect evidence-based patient care. Also, these are the nurses that are precepting and mentoring the new staff, so they felt they were the ones that really needed to learn about the new evidence-based practice. So my integrative review was completed at the end of 2019, so it's 2 years old now. So in preparation for this presentation, I searched for new literature on this subject. I didn't want to miss anything. I found some new international literature, but the findings were still the same. They were still fitted into the three themes. I thought maybe there would be a new theme around safety due to the pandemic, but there wasn't anything yet. I think that in the next few years we'll be seeing maybe that the safety theme emerge. There was no New Zealand literature, no new New Zealand literature, and there was only a couple of studies in my literature review, in my integrative review anyway. And I wanted to hear the current New Zealand voice on this topic. So I added a survey monkey to several New Zealand nurses Facebook groups, and I asked experienced nurses working in acute wards or EDs to complete. So that's what the next few of my slides will be on. So this is the results of my survey. So 300 people completed my survey. This was the first question: have you considered leaving your acute area within the next year? And 88% of those people surveyed said they were considering leaving. I suppose the sad thing was, when I saw this, was I actually wasn't surprised. The next question I asked was, why are you intending to leave? And it was free text section. So I received close to 300 responses in that section. I will share some of those of the main things with you as direct quotes from the survey in the next few slides. Tired, drained, nothing left to give. Many respondents spoke about having nothing left for their families or themselves, putting their health last, so becoming burnt out. People talked about the feeling of being a bad parent, a bad mother, because when they get home they're so exhausted they don't have time to play with their kids, or they're grumpy. Some of these responses from the survey I actually found quite upsetting, because these are my colleagues up and down the country that are feeling this way. Overwhelmingly busy, feel unsafe, constantly worried for my registration. So feeling unsafe was a huge response from people. Most of the 270 plus comments included the feelings of being unsafe. I never used to cry, now I want to cry every day. So nurses are saying this is the worst it has ever been after years of nursing. They have never experienced this level of acuity, short-staffed, or feeling of being unsafe. People also commented that the abuse from patients and family has increased. since they started nursing. And this is something I have noticed too on the wards, and I also work casually in the emergency department, and I've noticed it there as well. People are more abusive, more agitated. We are de-escalating a lot more than we used to. It's exhausting, frightening, and overwhelming. I feel like I'm never given the opportunity to actually care for my patients. So the nurses and the responses, a lot of nurses were saying that they're so busy supporting junior nurses with their patients, they have no time to actually care for their own patients. So they're not feeling like they're doing a good job. And as a senior nurse, you always take the sickest, most high acuity patients as well, generally. It's the patients I worry about. So typical of a caring profession, we're drowning and we're stressed and we're tired and exhausted. But our main worry is our patients aren't getting the care they need. So this was a very common theme. This kind of summed it up. Understaffed, undervalued, and not supported by management. So this was really common. That management doesn't care about the plight of the nurse at the coalface, is how nurses felt. So that was the recent survey I conducted in July and August. So these are some of the recommendations from my integrative review, my original integrative review, about what we can do to try and retain these nurses based on literature. So nurses who perceive their managers as supportive, value staff and appreciate their hard work want to stay. They want to stay in their wards and their emergency departments. Positive leadership has a direct influence on nurse retention. A leader who is visible, accessible and responsive to staff needs create better staff retention. Making nurses feel valued and appreciated by acknowledging their efforts and achievements informally by way of a conversation or a mention in a ward meeting. Decreasing nurse-patient ratios and managing workloads at a safe level will help retain nurses. An interesting retention strategy that has been successful in emergency departments overseas is the nurse manager rounding on staff or regularly checking with them during a shift. So the manager, when they say round, they talk with staff, give them praise and recognition for their work and build relationships with them. So this rounding strategy also provides more visibility of management to staff and greater perception of management support. Some of the United States hospitals with the lowest nurse turnover rates have organisational strategies that include building a culture of staff inclusiveness and involving experienced RNs in hospital planning and policy making. So we do have nurses on these committees involved in policy making currently in New Zealand DHBs, but some of these nurses haven't worked in the clinical setting, for decades, some of them. So I suppose the question is, are these the best nurses to have on these committees? They're not the ones actually having to follow the policies or the guidelines in practice. Do they really represent the common nurse in the areas? Another recommendation is annual performance reviews, where career goals and promotion opportunities are discussed and implemented. Putting senior nurses on education days and conferences. We really need to upskill junior nurses, but we need to be careful that the seniors are getting professional development opportunities too, as they are the mentors and the role models for junior staff. So some of these strategies actually don't cost anything. The clinical presence of the manager, the praise, the recognition, those are all free. To finish, I think more New Zealand research needs to be conducted on this topic. Most of the literature I found was from overseas, and we have very high turnover rates, 3 times higher than Aussie. So why is that? I think this needs to be explored further. Thank you for listening to my presentation, and I'm happy to answer a few questions in the live part.
Hei, tēnā koe whai Janine, tēnā te miha tiki a koe mō kōrero, hea tāhua te rongo ki tō kaupapa, why do senior ward nurses leave the acute setting? We're just going to see whether or not there is any chat. Nothing there any moment. Now I'm assuming, Kathy. There was some people were having trouble with their connections, so they've been directed to log back in. Lots of kōrero for Janine e pāna ki tō presentation. Great presentation. Every nurse is precious. This is a great piece of work. So no nei e te iwi me he pātai koutou. Discussion forum is up. We're just keeping an eye on that at the moment to see if you have any questions and they come through. Question, thanks. Do you know where these senior nurses go to, Janine?
It wasn't part of my research where they went to, but a lot of them are going to Australia. A lot of them waited till Australia opened back up and went there this year. A lot of them are moving into private practices, even clinics at the hospital, so the non-acute areas of the public hospitals, even like district nursing. So nursing that sometimes is but isn't actually in the acute wards or ED anymore.
Apai. Pātai anō tā koutou. How can we encourage management to involve senior nurses in the discussions making process?
I don't know. That's a hard question.
That's from Amber.
I know that as an educator, I quite often end up on committees as the clinical voice because I spend a lot of time in clinical as a nurse educator. So I suppose that would be a way to start, would be to have people that are on the floor in clinical practice on the committee so they can actually discuss what's actually happening. Yeah, but I don't know how else we have to get the hospitals to allow the nurses from the clinical setting to be on the committees.
Or maybe shout them a lunch and they might get them to the table. Coffee, yes, that's right. A question from Tracy Morgan. Did you get to show, this presentation to your CEO to perhaps raise the awareness? This is a fantastic presentation.
I did actually present this to our nurse director at our hospital, actually, and to our human resources team at Waikato Hospital.
Tēnā pai. I think this is a comment from Jacqueline. I am working with the CCDM team at CDHP, and I will take this back to our team as this kind of work will be useful to help us explain to the top management and accountants what is going on and how to fix the brain drain.
Good.
And last, this from Claudia. Was there any mention of shift work contributing to nurses' decisions to leave acute settings?
There was a few. I looked at lots of literature, and there was some of them talked about shift work, particularly for the nurses nearing retirement age. That shift work was an issue, but it wasn't a big issue. It wasn't a big theme in the literature. The main things were the ones I discussed. So occasionally shift work came up, occasionally personal issues came up, but it was mostly the things I talked about was the reason people left or were thinking of leaving.
Yeah. Is there any research that does pre and post tests put in practice solutions to see whether they stay?
That one I talked about the ED was really interesting with the manager rounding on staff. I can't remember the statistics, but they did increase their nurse retention by employing that strategy. And in the States, I think they're called baccalaureate magnet hospitals. They are quite good at retaining staff, and they have lots of different ways they do that. So if you wanted to search what they do in the magnet hospitals, there was some quite interesting stuff around what they do as well to retain their staff.
I've got two more questions for Janine for you before we move on to the next speaker. Where can we get a hold of your work?
I published in the Kaitiaki magazine in May this year an article, and I also published a little research snippet in the Kaitiaki Research Journal. But I actually, when I was doing the literature review to make sure I had up-to-date information in July, I found myself on Google Scholar. I was quite excited. So if you go into Google Scholar and search this topic, you'll find my 2 articles in there. It was quite exciting.
Oh, that's cool, Fire. That's really, really cool. And the last question from Kathy Lee. Are there any examples of exceptional leadership where staffing turnover on the ward is low and could be used as a pilot for other DONs?
That's what I was saying before about the rounding in the ED and about the magnet hospitals in the States. It would be quite a good maybe research topic going forward for somebody. I don't know, maybe me, I'm not sure, about, what strategies have been used and how they've worked. But my main focus was why. Why are they leaving?
Kapai. And I'll take this last one because it is a good question. Would you recommend any education for CNM and learning to work with their teams?
I think we used to have some education called customer service education, and a lot of our receptionists went to it actually, but it was actually really good about learning to talk to people, recognizing people, appreciating people, just that human connection stuff, I suppose, is I think what's missing sometimes. I think nurses feel like quite often if something goes wrong, they get talked to, but when they do something right, which is 99% of the time, no one really acknowledges it. And I think that's kind of one of the main issues, to be honest.